Welcome to the Gifford Provider Podcast. This is the podcast of Gifford Healthcare, located in central Vermont. I'm Scott Fleischman, and I'm the communications specialist here at Gifford. Gifford's a nonprofit critical access hospital and federally qualified health center with a total of 9 locations. The medical center in Randolph is home to a 24-hour emergency department, inpatient and rehabilitation units, a renowned birthing center, accredited cancer program, advanced diagnostic imagery, surgery, and much more. Go to giffordhealthcare.org to find all the services we provide. My guest for this episode is Gifford physical therapist Amy Chiriatti. Amy has been working in general orthopedics for more than 20 years, first joining Gifford in 2009. Her clinical interests include sports injuries, the Sacroiliac Joint, and dry needling, something that I've had before. We can talk about that in a little bit.
I'd love to talk about it.
Yeah, it would be great. Before we get into that conversation, though, a couple of quick reminders. If you're watching us on YouTube, don't forget to click the subscribe button, like this video, tap the notification bell. And that way, you'll always know when we have new content for you to watch. Our YouTube page has other podcasts, important information from our medical team, videos showing why Gifford is a great place to work and a great place to be a patient. We also feature our Morgan Orchards Senior Living Community, which contains a 49-unit independent living facility and award-winning nursing home. And you can now listen to the Gifford Provider Podcast in your car or while just going out for a walk. You don't have to watch it on YouTube. We're on Spotify, Google, and Apple Podcasts. So do a search for Gifford, follow the podcast, share it with your friends. It would be greatly appreciated. Okay, Amy, after we've gotten all of that out of the way, so more than 20 years here at Gifford, coming here in 2009. Let's start there. Let's start with why you decided to, or how you ended up here at Gifford and the circumstances there, and why you've decided to stay.
Well, physical therapy is actually a second career for me. I had a life before I went back to grad school to get my master's in physical therapy, which was in Madison, Wisconsin. And I worked in a town just north of Madison for 10 or so years and wanted to move back to Vermont, where my mountains are and my family is. And I picked Gifford. It was a great opportunity for me to start in at a ground level of the opening of the Wilder Clinic, which has since moved to Twin River.
Twin River is one of the other locations that we have. We're spread out throughout central Vermont. How is it like being down in that area?
It's great. I thought I was going to miss the Wilder location because it was pretty spectacular for a lot of reasons, but I love being downtown. I love being in White River. The building is nice. It has great access with parking and it's very friendly. The gym space we have is nice and there's it's open and beautiful, very private.
So what's kept you here for more than 20 years?
Gifford's a nice place to work. It fits for me in so many ways. I live in Tunbridge, so driving to the Upper Valley is not too onerous unless it's a snow day like today and the roads are hard to access. It's the clientele is fantastic and the team that I work with is fantastic.
Talk a little bit about what does go down in the Twin River Center.
There's 1.5 physical therapists there. I share an office with Dawn Arnold and Joe Alexander, who both also work in the Sharon Health Center. And the receptionist, Sheila Jeffrey, is she's the glue that holds us all together. I can say that pretty clearly. We see lots of different injuries and illnesses and pain issues. Sometimes it's not pain. Sometimes it might be a vestibular issue or pelvic floor issue, lymphedema. Those are some conditions that we work with. We'll pretty much see anything that we feel like we can treat. And if it's something that seems too out of our realm for whatever reason, we'll find another provider for them to see. I don't have any specialty in hand treatments, for instance, so I'll refer hand and wrist issues to one of our occupational therapists who are masters with the hands.
And I think that's one of the cool things about Gifford is, offer so many services, such a broad spectrum, and we have providers with such different skills that if somebody does come to the physical therapy department with an issue, you can, hand them off, no pun intended, if with a hand injury, but you can do that with somebody, and this provider, well, this is in their skill set. You can talk to them, or if we have other patients with other problems, if it's or illnesses, whether it's a diabetic problem or just a chiropractic issue that needs to be resolved, you can kind of just refer them to those clinics that we have available here that you're not going to find in many small rural hospitals.
Yeah, we have a lot of systems in place to connect people with the providers that they need, and the providers, and they communicate. I think that we all communicate pretty well with patient care. It's easy to access patient records to find out what an x-ray might look like, or to talk to the chiropractor to see what they've seen on the x-ray, or to discuss something with the orthopedic doc. Everybody's really accessible. We
were talking in a podcast, couple podcasts ago with physical therapy, and we have a sports medicine program. One of your specialties is sports injuries, but we're not, we're in small town Vermont, and Vermont is not known for producing professional athletes. We have several local colleges here where we have, athletes for that, obviously high schools. But I imagine a lot of the injuries that you see aren't necessarily like, high level sports injuries, or more probably the farmer or, the logger.
We see all sorts of injuries and illnesses. Yes, Dartmouth College and a bunch of high schools are right in our area. So we get referrals for some of those athletes. And I would say the majority of the people that walk through our door are not specifically athletic injuries. They're injuries that might keep them from their activity. And yes, there are some functional and rehab components of our work that have nothing to do with sports, trying to get somebody back to their job, or as you mentioned, back to their farm field, or back to their recreation. Some people were just trying to get them back to, interacting with their family. There are lots of reasons that we'll see people that have nothing to do with sports at all.
After I left the military, I missed that feeling of belonging to something and feeling a part of something special. And that's exactly what I got when I came here at Gifford Medical Center.
Apply today. Go to giffordhealthcare.org/careers. In your experience, how often do people come see you when they've had a nagging injury for a while? Not, it's just, well, I've had this for months and months, and now I'm finally going to do something about it. And why do you think that is? Why, people kind of let things linger a little bit, maybe sometimes until it's too late, or it affects another part of the body. Like if you have an IT band issue, that can affect your back, that can affect your hips. So, did you see that often? People kind of hold off on that until it's like, really painful?
Absolutely. Yeah, absolutely. People come in after weeks, months, or years of trying to deal with an issue on their own. And they kind of get fed up with how it's not resolving. And they come in and they're pretty committed to this project of getting their whatever it is better. And some people come in and they'll sort of give me a hint of how it started. They'll talk about their back pain, and they'll say, well, it didn't really happen with anything specific, but a year ago I broke my toe and I've kind of been limping off of it. So yeah, it can absolutely work up the chain or down the chain. And people, I think in general, are pretty optimistic, and they think that an injury is going to get better on its own. And I think that when we are younger, they do heal much more quickly on their own. And as we get older, it's trickier to let the body resolve those issues.
What are some of the more common injuries you've seen?
It's funny. I feel like the injuries that come into the clinic seem to come in spurts. So I'll have and I'm not really sure exactly why that works, but I'll have a week where I'll get 2 or 3 or 4 referrals for somebody with back pain. And then the next week it'll be a bunch of ankle sprains. And then the next week it'll be, some shoulder rotator cuff problems. But those are some some regular injuries we see. Also, knee pain, hip pain. We see a lot of post-surgical cases because Dartmouth is right around the corner. We get a lot of their total joints. And of course, our providers refer for their total joints that they might refer to us. And I guess most of the injuries we see are just kind of run of the mill, hurt my back shoveling or twisted my knee walking, or my dog ran into me and I fell over or something.
So if somebody does come to you with an injury, what can they expect from Gifford, from yourself in terms of treatment? How do you work with the patient to kind of get through that?
Yeah, we get them scheduled up as quickly as possible. And then they come into the clinic, and usually we spend about an hour with them trying to decipher what the problem is and how to make them feel better. I like to make a significant change, if I can, in their comfort level so that they feel like physical therapy is a good avenue for them. I like to get them set up on an exercise program so that they can continue their well-being on their own. And then we come up with a plan based on whatever goals they have. Their goals might be to be able to walk up the stairs using just one handrail, or to be able to walk to the mailbox. Some people might have goals of even just, picking up their kid after a back injury that they haven't been able to bend over and lift anything. Some people want to be able to run, a mile. Some people want to be able to finish a marathon. We just have all sorts of goals to work on. There's often a pain-related goal, but not specifically. And then we'll figure out a good treatment plan for having them come back. And physical therapy has changed in the last 20 years. Even before I started as a physical therapist, it was sort of expected that you might go to your physical therapist 3 times a week or something. And that's just not how we practice anymore. Maybe it's a combination of the people in the Upper Valley who really want to work more independently, or maybe it's still one of the serpent's tails of COVID and how people don't want to get out in the community and they want to stay home. But I would say a lot of my clients come in maybe just once a week, maybe once every couple of weeks, just to maybe boost their home exercise program, or to deal with some nagging thing that hasn't gotten yet resolved. There are definitely people that I see twice a week because they need some accountability in physical therapy, or they've got some injury that just needs just regular working on until it gets resolved.
You mentioned it a little bit. What prompted you to get into physical therapy in the first place?
I was between lives, I was a personal caregiver in Madison, Wisconsin. And I was a caregiver for this woman who had cerebral palsy. And one day I worked with her for many, many, many weeks, many months. And one day I asked her if I could please walk her down the hall in her apartment. And she has been in her wheelchair for 42 years, and she's had lots of physical therapy and lots of surgeries. And she kind of rolled her eyes at me and said, "Amy, I've done this before. I'm not interested in walking. I'm fine in my wheelchair." And I gave her my old puppy eyes, and she said, "Okay." And I helped her walk down her hallway, and I got her into her sitting in her couch. And I just immediately fell in love with the process of helping somebody do something that they might not be able to do. Now, this woman in particular wasn't interested in walking, but I felt like I would be able to make that kind of change in other people's lives.
When I first moved up here after college, no one would take a chance on me, and Gifford did.
It was quite a surprise to be able to finish my degree and work here.
At Gifford, it just feels like home.
Apply today, giffordhealthcare.org/careers.
And obviously you have, because for you to be able to be doing it for so long, that satisfaction, I'm sure that doesn't go away.
It's so rewarding when you can make that kind of change in somebody's life.
So one of the services, or one of your specialties, dry needling. And so last year, or maybe a year and a half ago, I don't know, with the pandemic, time doesn't really exist. I did. I had a dry needle treatment just to kind of see how it was. And I remember it was in my hand, and you can really feel it. I mean, afterwards, you could just feel the pressure release a little bit. Tell us a little bit about, for people who may not know what dry needling therapy is and how that helps and what it does.
Yeah, so I took a class in dry needling maybe 3 years ago or so, and it's absolutely changed my practice and the comfort of many, many of my patients. I guess the first thing I should say about dry needling is that it's not acupuncture. And I know that acupuncturists have a long school process and a certificate and a degree, and I don't have that. I have my master's in physical therapy and a continuing ed credit of 30 hours of a weekend. So while I have lots of experience in handling people, I don't have the knowledge of acupuncture at all. We do use acupuncture needles, and it's called dry needling because there's no hole in the needle for a medicine to go through. And much of my treatment involves trigger point release, where I might get the needle into an active trigger point, up in the upper trap or in the glute, or really any body part where there's a spasm or a trigger point. And sometimes just putting a needle into an area of injury where there's other kind of pain will help release the pain. And as you said, you felt the tension release. I think that's one of the benefits that dry needling provides. It's used on the premise of creating micro trauma, and the micro trauma will bring in blood flow for healing. When I use the dry needle in a trigger point, sometimes I'll manipulate the needle a little bit, and I can feel the tissue change in my needle.
So how often do you perform the treatment on people, and are they skeptical at first, or like you said, they might confuse it with what acupuncture is?
I give them a quick instruction on how it's different from acupuncture, and I explain to them the possible risks and benefits of it. And usually people are pretty willing to participate. I won't needle anybody who has concerns or, needle phobia. I think that that's just kind of a setup for disaster, because they will be more tense or more uncomfortable. And obviously they have to be willing. I'll see people sometimes twice a week. Sometimes I'll just see them literally once or twice to have their tension resolve and get them on their way with a stretching program or a strengthening program.
What about some other techniques, some other hands-on techniques that you use?
I think one of the manual therapies that I get the most bang from is joint mobilizations, and that's getting in there and basically wiggling the joints around so they move more freely in their capsule. That can relieve a lot of stress. It can increase range of motion significantly, and it's pretty powerful for patients when they walk in with a limp and they can walk out without a limp because you've moved their talus bone back into place or whatever. Soft tissue mobilization and deep tissue mobilization are a couple of manual therapies that we use depending on, what kind of injury is going on. Cupping is something that I've just started dabbling in a little bit. I actually brought a couple of tools here. This is one of the cupping sets that I use, where it just kind of sucks the skin up and stays in place. And that can help decompress the tissue, as opposed to when you're massaging, it kind of compresses the tissue. Other manual therapies might be some stretching or mobilizations with movement. I guess those are most of the manual therapies. I also brought another set of instruments. This is a tool. It's an instrument that I use, instrument-assisted soft tissue mobilization. A lot of people know this technique is called Graston, and I haven't taken a Graston course, so I can't say that I performed the Graston technique. We have clinicians in Kingwood and Sharon, I know, that do the Graston, but I perform instrument-assisted soft tissue mobilization instead, which is sort of an umbrella term for using instruments for tissue work.
Well, that's so cool. I didn't think we'd have show and tell. The cupping, when I've watched, you watch the NBA and you see some of the athletes, they have the circles on their back so that's the cupping technique. And that's really just caught on over the last few years, right?
Yep. It's been used in traditional Chinese medicine for centuries, but I think that we're just beginning to practice it in physical therapy. And I think that it's something other practitioners, acupuncturists, use pretty regularly, but it's relatively new to PT, I think.
So we're in the middle of, we're taping this. This is our March podcast. So we're right towards the end of winter. We were kind of joking earlier about, all the different Vermont seasons, but we've been kind of sedentary for the last few months with winter here, unless you're out skiing or the warmer weather isn't here yet. So, people want to get back out the minute that it's nice out and start doing stuff. So, what are some tips that you might have for people who are, maybe they've sat on the couch a little too long, especially with the pandemic, haven't been out. It's winter. Now it's finally time to get out. The weather's getting warmer, but you can get injured pretty quickly if you aren't doing the right things at the right times, right?
Yeah, I would say start now. It's never too early to start getting in shape for whatever you want to be in shape for. And it's true. I think that when you get into the next sport, the next activity seasonally, it's hard on the body to just start right out of the gate, right out of the couch. So it's well worth just any kind of fitness that you can give yourself before engaging in that, even just going out for a walk or doing some online videos that seem like they're up to your level of fitness.
How important is, and we've talked about this in prior podcasts, but stretching. I always ask about stretching and how important that is, even if you're not especially if you're not going to be active too much, to just keep stretching your muscles and kind of elongate your spine and keep up that way.
Yeah, the body likes to move. Movement is how we're going to stay well. And even, when people come into therapy and they're a little bit more sedentary and they're painful because of something that they've been dealing with, literally just getting them to move and getting them away from being afraid of moving is a huge part of what we do. And they'll feel better just for beginning to move through some of the discomfort.
And with spring comes, spring sports and students getting back out there again. You talked earlier about how, when you're younger, you can kind of bounce back from injuries, but some injuries or some problems, you can't bounce back right away from. What are some things or some tips for some students who have been, ready to get back at it? Practices starting up again for the spring sports season after they've been kind of sitting around for the winter? Again,
just get your body moving before you're getting the high physical demands of whatever your coach is asking you to do. I think that those first couple weeks of any sport, whether it's the spring sport or gardening or seasonal workers, anything that's coming out of a long, slow period of stillness is tricky. So being consistent with your activity and committed to your progress is important. You just got to remember that you're a year older than you were when you started that sport last year.
With the high school sports, what are, even some of the college sports you see at Dartmouth, what are some of the common injuries that you see with athletes these days? I mean, has it been relatively unchanged over the last few years? Does it kind of fluctuate? I guess, depending on the sport?
Yeah, depending on the sport and the season, I'd say, when people ramp up their running, we'll see more foot injuries, foot or knee injuries. In the winter, we'll see maybe some more hip injuries from hockey or skiing. That's pretty hard on the hips. We don't have a swimming program here, but that would bring on more shoulder injuries. I've seen people from the aquatic center who come in with shoulder issues from swimming.
You talked about feet, and our last podcast, we had podiatrist Dr. Nick Benoit on, and I suggest everybody listens to that podcast because there's some great information there about foot care. But, it's big with physical therapy as well. I mean, the proper footwear can mean the difference, right?
Yeah, I think getting into gear that is appropriate is really helpful. Getting your shoes that fit. I've been a big fan of Omer and Bob's and State Line Sports. That's where I refer people when I'm suggesting that they get new footwear. Getting shoes that support the ankle. And the people who sell the shoes are the ones that know them. They get information from the reps, and they know if it's a stability shoe or a mobility shoe. They know about cushioning and zero drop heels, and they're the ones that are going to provide good information about the footwear. Having equipment that fits and is suitable for your sport is important. I think footwear is, and I'm sure Dr. Benoit would agree, footwear is key to comfort and good body work through athletics.
When you're trying on a pair of shoes or sneakers, I always grew up with my mom, would try sneakers on, and she always take her thumb and kind of space out between your big toe and how much, room you have up front. Is that, how do you find that right fit? I'm obviously, like you mentioned, you could probably talk to the people working there, to consult with them. But if you're unable to do that, how do you know the proper fit?
Yeah, it's trying the shoes on. I go into the shoe store with ample time to try on as many shoes as I need. And I start with the socks that I will be using when I use the shoes. If I, think I'm going to be running more in the summer, I might have a thinner pair of socks on. And if I'm doing trail running or winter work, then I'll have a thicker pair of socks on just to try the shoes on. The people who set you up with trying shoes on are pretty patient, and they have knowledge about where the arch is supposed to hit your foot and how high up the heel it's supposed to support you, and even different ways to tie laces to give you more support across the top of the foot. And I think the good old pressing your thumb into the tip of your shoe to see how much room your big toe can wiggle around is also what they suggest.
My favorite part of working here is that I get to take care of my friends, my family, and my community.
Gifford has been very supportive for me. They let me go get my education, and I kept working.
I like the small clinical setting that we have and the community outreach that we do here.
There are things that are really supportive for families here. We have a daycare center on site. The people here are the best part about Gifford.
Trends are such, especially for physical therapy, we talked about cupping and dry needling. Trends are such a big thing with this kind of treatment or physical therapy in general. We talk about shoes, and I thought a trend for a while there was, and maybe it still is, you see commercials for it, copper wear, socks, or a back brace that you put on, copper. Do you have any experience with that? And is that something that's legit?
I don't have any experience with it. I do have some patients that come in wearing copper bracelets, or they'll say that they just bought a mattress with a copper or something or other. I can't speak to the efficacy of it. And I think in general, if you try something and it is helpful, then it's helpful.
I think people will do whatever it takes to not go see somebody, right? They try to, I think they will try to, oh, well, I've had this nagging back pain. I'll wear a copper, brace, or I'll wear a knee brace. If the knee, instead of just, going to see someone like yourself, trained professional who could probably help get you out of that situation.
Yeah, I think we're all interested in being a tiny bit passive and have things done to us. If you can go about your day with a back brace on or a copper bracelet on, then you can go about your day. But if you have to take time off and go to your therapist and follow through on the exercise program that they've given you, then it's work. And it's well worth the work. And I think physical therapists educate their patients really well. It's one of my favorite things to do with people is get out my anatomy book and show them where their tendon is going around their shoulder and why their tendon is bothering them and why their attachment point to this bony prominence is sore. The education we give them is well worth their initial visit, at least. And we just keep educating them on what they need to do to get better.
Well, because the longer you wait on something, you're going to affect another part of your body. I mean, for years, I had IT band issues, and I was overcompensating. So it ended up hurting, another part of my body, my lower back, for something that was, an IT band thing. So, it's better safe to just get that nagging thing taken care of, because it will affect other parts of your body. And then you have to rehab 2 parts.
Yeah. And it gets a little tricky, because if you were to come in with back pain, then we would start working on your back pain, and it would take we'd have to dive deeper into the actual cause of your back pain, which is your tight iliotibial band. And, we could treat your back pain until we're blue in the face, but it's probably just going to continue to bug you until we get to the root cause and fix the iliotibial band. So do you have any other advice for people right now as we kind of look towards spring and get out and, even as we try to get through the end of the winter months here for people, considering some of the stuff you've seen recently? I'd say give yourself some slack, get into it slowly, commit to something that you really want to pursue. It helps to have some goals and figure out a way to execute the goals. If you're trying to start a new sport or meet a new goal of a running race in the fall or something, being committed to it. I think commitment is a more valuable term than motivation when it comes to getting yourself started in a new activity. Being committed to it is key. And yeah, be nice to yourself, pay attention to what your body's telling you in terms of aches and pains, and don't wait too long with those aches and pains before you go to a provider and get them sorted out. One thing we didn't mention, and I forgot, we were going through your clinical interests, and one of the things we wanted to talk about was the Sacroiliac Joint, which I hadn't heard of until I was doing some research here for this podcast interview. So tell us about that and why you decided that was one of the specific things you kind of you want to have a clinical interest in. Yeah, I've had a crush on the sacroiliac joint for a long time. It is hard to sort out the sacroiliac joint, and I like the puzzle of it. And when it's working properly, then it feels great. And when it's out of position, it feels really lousy. The sacroiliac joint, there's 2 of them in the lower spine. It's where the sacrum, which is the lowest part of the spine, meets each of the pelvis bones. And there's clinicians out there that believe the sacroiliac joint doesn't move. And I believe that it does move. People think that it's a fused joint and shouldn't move, but when it's out of alignment, it's pretty clear that it should be in alignment, and it has been moved out of position. There's lots of different techniques to get the sacrum back in place, and usually the lower spine follows the malalignment of the ilium and the sacrum. So we also end up working with the lower spine also. Of a percentage, I mean, how often is what you see attributed to the joint, to the sacroiliac joint? I wouldn't be able to say. Maybe because I like the sacroiliac joint, I blame it for a lot of stuff, because then I can dig into it and sort it out. I'd say that a lot of people that wind up with back pain or sciatica, I often attribute first to the sacroiliac joint being a little out of alignment. The piriformis muscle in the buttocks is something that gets into a spasm and can pinch on the sciatic nerve. And of course, sciatica can also come from a true injury in the back as well. But I like to rule out whether or not the sacrum is a key player.
Well, we've gone over a lot of topics here, and I really do appreciate it. One thing I did want to ask, we talked about the cupping. Is there any other techniques you're kind of researching, studying up on, or, thinking about putting into practice?
Yeah, I'm midway through a new course in visceral manipulation. I'll be taking that course sometime later this summer. It is a technique that helps to mobilize and give more motility to the organs in the abdominal and I guess in the thorax that can help relieve different pains and issues and things that I wouldn't necessarily know are attributed to a stuck organ. I've had this technique done on me a couple of times and it's pretty spectacular. So I have a new special interest in learning this visceral manipulation. On the next podcast, whenever I'm on again, I'll be able to give you more information.
Well, we'd love to hear that. I'd love to get an update on it for sure. Well, Amy Chiriatti, thank you so much for joining us on this month's Gifford Provider Podcast. You can find out more information on Amy, her background, and also the Twin River Health Center in White River Junction by heading to our website, giffordhealthcare.org. You can find out all about the advanced physical therapy that they do at Twin River. We also have our great folks in our Sharon Health Center that also deal with sports injuries and other physical therapy issues. We have our Kingwood Health Center in Randolph that also deals with some physical therapy as well and rehabilitation. So we've got you covered throughout the area when it comes to pain and managing it and trying to get over it. So again, Amy, thanks so much for joining us and have a great spring. And hopefully you're busy, but not too busy with people with those nagging injuries and they're doing the proper things to get back out there and staying healthy.
Thanks, Scott. It was a joy working with you today. Thanks.